Morning. My name is Asim Srivastav. I am a pediatric cardiac surgeon with Artemis Hospital, Gurgaon. And today let us talk about VSD, a simple heart condition in children. So, using a diagram, I will first explain what a VSD is, then we'll go to the symptoms and finally what the treatment is. So, if you look at a normal heart, there are 4 chambers, 2 on the right side and 2 on the left side. Right? Right atrium, right ventricle, left atrium, left ventricle. So blue blood from the body will first return to the right upper chamber. It will go to the right ventricle, and right ventricle through one pulmonary artery, it will pump it to the lungs. Right? So lungs will put oxygen into it. Blue blood will turn red, and this red blood returns to the left upper chamber, goes to the left ventricle, and left ventricle pumps it to the body. So blue blood is on the right side, red blood is on the left side, and God has made a partition in the middle so that they don't mix. A bigger reason that this partition is important is the pressure difference. So, blood pressure, as we all know in the body, it is about 120 millimeters. So, God has made this pump such that it will pump blood at a pressure of 120. This is the pressure that our body needs. Similarly, normal blood pressure in the lungs is 30. And right ventricle will pump therefore at a pressure of 30, and so this wall is extremely important to maintain this pressure difference. Unfortunately, in a child with a VSD, there's a hole in this wall, ventricular septal defect, right? So this hole, what happens is blood at a very high pressure will now go to the right ventricle, and the pressure here will increase. It will no longer be 30, and the same pressure goes to the lungs, and this pressure will increase. And that is why these kids will have shortness of breath, failure to thrive. There will be more higher chances of pneumonia, and ultimately when the load on the heart is more, this heart becomes bigger and weaker, and heart failure happens. And therefore, it is extremely important that we close this hole in the heart as whenever permitted. And as you can understand, if the VSD is big, it is a non-restrictive VSD, it is extremely important that this VSD should be closed, and even more important that it should be closed before the age of 1 year.